Well, good afternoon and welcome to our Dairy Goat webinar series. My name is Jennifer Bentley. I'm a dairy field specialist with Iowa State University Extension and Outreach, and I'm housed in Northeast Iowa. And I'm excited to bring this webinar series back this fall. This is part of our Dairy Goat Sustainable Agri-Systems grant that we have through the USDA NIFA. So this is a 5-year project. If some of you have been following along with us, we've started to develop some educational materials around this project. And we now have a website that we've launched called Dairy Go Agri Systems. So if you want to learn more about the project, you can definitely check it out there, as well as we do have a newsletter that we've created along with this. So I know some people that have joined the webinar have started to subscribe to that. So we can get you more information about it as we go along. So today's topic, we're going to be talking about animal welfare for dairy goat producers, and happy to have a former colleague on the call with us, Dr. Michelle Buckley, as she talks about the topic here today. And I'll just do a little introduction of her as we start here. But Dr. Michelle Buckley graduated from Western University of Health Sciences with her DVM in 2017, and then she served small-scale farms and ranches of Southern California's Inland Empire, where she began growing her love of small ruminants. And then in 2021, she began a PhD in microbiology and clinical pharmacology at Iowa State University, where her work focused on subclinical mastitis and antibiotic stewardship in dairy, goats, and cattle. And now she is currently the director of the Warsaw Quality Milk Production Services Laboratory through Cornell. And she's excited to serve the bovine dairy producers of New York and expand the support of dairy, sheep, and goat producers as well. So happy to have you back on the webinar series. I know you did some past ones with us when we were working on the mastitis and antimicrobial stewardship project. So looking forward to today's presentation. So go ahead.
Thanks a lot, Jen. Thanks for having me. It's good to be staying connected with my friends over at Iowa State. So, all right. So, just a little overview of what we're going to discuss today. We're going to go over some signs of pain in goat and what the effects are of unmanaged pain. And then we'll talk about painful procedures and problems that we can encounter, specifically in dairy goat production settings. And then, of course, we need to start talking about our pain management options. Mostly, we'll talk about drugs in this case. And then also a little bit about humane euthanasia as a treatment option for pain, specifically for dairy goats. And then we'll wrap it up. So, Jen, I think we had a little poll to go out, or am I doing
Yep.
this at the wrong time?
No, I can launch it. Yeah.
Okay,
So
go
if we
ahead.
just, I'm going to launch a poll that just has 3 questions here. You should be able to see them here, just kind of getting a good understanding of our audience here today about current practices and how you feel about pain management, whether you're working with producers or you yourself are managing. So the questions I have up there are, do you feel you can identify pain in an animal? And the second one, do you feel comfortable making decisions regarding quality of life and end of life decisions for your goats? And then the third question would be, do you feel competent at performing humane euthanasia on a goat? And so we'll give people a little bit more time to fill those in. You are seeing those, right, Michelle?
No.
Oh,
I
okay.
mean, I saw the questions, but I can't see responses.
Oh, yeah. Okay. Yep.
Okay.
Yeah, once I end the poll,
Okay.
I'll let you see the responses here.
This is pretty high tech for me, Jen. I'm not
Okay.
as adept as you are at
Yeah.
this.
Looks like we have the majority that's filled this out right now. So I'm going to go ahead and end the poll. And so now you should be able to see those
Okay.
results,
Yeah.
Michelle. So,
So 75% of our attendees today feel that they can properly identify pain in an animal. Kudos to the 25% who were not confident about that. That is okay. That's why we're here. Um, Feeling comfortable making end of life decisions, 88% feel that they do. That's really awesome. Those are really hard decisions to make. And I hope the 13% that said no might have a little bit more insight by the time we're done here today. And then for question number three, 63% felt competent at performing humane euthanasia on a goat. That's great. And for the 38% of you that said that you did not, that's totally fine. You should not walk away from this webinar prepared to euthanize a goat just based on what I'm presenting to you. This is going to take some training from your veterinarian as well, but just hopefully a jumping off point and some basic information that you can start a conversation with. So, all right. Well, let's dive in here. So the thing that I hear a lot from clients, whether it's goats or sheep or cats and dogs, is she's not crying. So I don't think she's in pain. And I don't think that's really an accurate way to assess pain because even people, you sprain your ankle, do you sit there crying for days on end? It might hurt initially to the point that you'll cry, but it's probably still going to smart for a couple days. But that doesn't mean that we sit around, yelling about it. And even though goats can be pretty sensitive creatures, they have different ways of showing us that they're in pain and discomfort. So how do we identify pain in goats? This is one of my former patients who had a broken leg. And she really doesn't look too miserable after having that leg cast, even though I'm sure she was still pretty uncomfortable before we gave her some pain meds. So painful procedures and diseases that we see in dairy goats, most commonly disbudding, mastitis. These are disbudding. We know, you're applying a hot iron to the head. That's going to be uncomfortable. So we need to be making sure that we are mitigating pain appropriately. And I would argue that a lot of these, we can't completely eliminate pain, but we can definitely do quite a bit to mitigate it. But pain and painful procedures and illness are just kind of a part of production, especially in dairy production, because we do have reproduction happening. That's an uncomfortable process in and of itself. And then the diseases that just naturally tend to come along with that. So mastitis, metritis, if we need to intervene with kidding, dystocia, we need to be extra cognizant of the discomfort associated with that. Lameness is going to come up, especially because these guys are walking to the parlor a couple times a day. Sometimes surgery is necessary, whether it's a C-section or a goat, a horn, a broken horn, and we need to repair the wound from that, which is what you're seeing here in this picture on the left. That's the open sinus from a broken horn in a mature goat. That's really painful. And even things like respiratory disease can cause significant discomfort that can be mitigated with proper pain control. So the picture here on the right is just a really sad, uncomfortable looking doe who we were treating for respiratory disease, actually. But she just looks like she feels terrible. So what are some signs of pain in goats? I just told you that goat looked like she felt terrible, but how did I know that? So like I said before, sometimes they will vocalize, especially with a really acute discomfort, like an injury, a predator attack, something like that. But in other cases, you might see something like teeth grinding. And if you've ever heard that sound from a goat before, you will never forget it because it is nails on a chalkboard level uncomfortable to hear. But they'll just sit in the corner and they look like they're chewing their cud, but really they're just grinding their teeth. Rapid breathing can be a sign of illness, especially respiratory disease, but can also be a sign of pain. And so keeping an eye out, knowing what a normal resting respiratory rate is for a goat, and then or what your goat's normal respiratory rate is. And then if you notice them, panting or breathing really hard, that can be a sign of discomfort as well. Posture changes or a hunched posture, you can see in the picture here on my screen. This little goat kid looks miserable. He's got his head down, his ears are really droopy, his back is hunched. His tail is still kind of up, which can be another indicator of pain and discomfort if the tail is down. But I think we can all agree this is a pretty sad looking goat kid. So posture definitely can be a good indicator. Agitation, again, this kind of goes along with posture changes where they're up, they're down, they can't get comfortable, they're all over the place. Another thing that we might notice that's kind of opposite of this is they're shutting themselves, or they're putting themselves in a corner. They don't want to move. They're not doing their normal activities. Um, so goats can conceal their pain as a prey species, and they might do something that you just aren't used to. And so I would tell my clients, anytime that you think something is off, if they're doing something and you're like, huh, that's weird, or if they're not doing something, like, first one that's always up at the feed bunk is, still laying in the corner while everyone else is eating. When you say, huh, that's weird, that's something we need to know about, and your vet needs to know about, because that is probably an indication of illness or pain or discomfort, or something wrong. So Dr. Plummer and Dr. Hempstead just published a paper in 2025 that did a really good job of quantifying how often we see these different behaviors, in cases where we know that the animal is in pain or suffering somehow. Let's see. So pain versus illness, I think, is really important to differentiate. So this is a sheep. Obviously, we're talking about goats today, but you could see this just as easily in a goat. This sheep is having severe respiratory issues, and she's in distress. So is this animal in pain? Probably not. Does she feel really yucky? Yeah, most likely. Would she benefit from a medication to make her more comfortable that we would probably call a pain medication? Yeah, I bet she would. I bet a dose of an NSAID would probably help her immensely. So sometimes we tend to separate pain from illness. If you have the flu, you're going to take some Tylenol or some Advil, right? You're not in pain, but you still need some medication that will address inflammation and help you feel better. And that's kind of the root of a lot of this, is dealing with inflammation. So why does pain control matter in dairy production systems? Because these goats are tough, and a lot of times they'll just keep on trucking, and we can still get them to the parlor or up on the stand, but they definitely aren't themselves. So when we're using NSAIDs specifically, so that would be like your Banamine or meloxicam or ketoprofen, or carprofen even, what differences do we see in animals that are in pain or ill? In dairy production, specifically in bovine mastitis, there was a study that found decreased udder edema and lower body temperature, so fevers were controlled well, even in cows that had endotoxic mastitis. So this is really nasty mastitis. These cows feel systemically really ill, but we can pretty significantly improve some of those problems, udder edema and body temperature and fever, just by giving them a dose of an NSAID. In this case, I think they were using meloxicam. Of course, we know that goats are not cows, but I think that we can all agree that goats are maybe even a little bit more sensitive than cows. And so I would imagine that if this study was repeated in goats, they would certainly see a similar or maybe even more marked improvement with pain medication on board. Another study found higher overall milk yields and protein yields when cows were treated with meloxicam after normal calving. So these are cows that just calved on their own, and they were given an NSAID shortly afterwards. I think it was within 36 hours. And they were seeing higher production just from managing that pain. And we all know that there's pain and discomfort and a lot of inflammation during the birthing process. And these girls do feel it for a couple days afterwards. So if we can help with that, I think we definitely should be. And you're going to see the returns in your profit margins when your animals are producing more milk and they're able to turn themselves around faster. Another study in 2020 found a faster return to normal behaviors after goat kids were disbudded, depending on whether the people disbudding used pain medications or did not. So I think these folks were also using meloxicam compared to Banamine or flunixin, and then they had a group that was a control group and didn't get meds. And so they saw differences between those two anti-inflammatory drugs, getting these kids back on their feet faster. And That means faster or better intake of feed, and which turns into better growth. And whether you're raising bucklings for meat production or doelings that you're going to put into your milking herd, big, healthy, strong animals is what we're looking for. So we definitely want them to get back on their feet, normal behaviors, normal eating, normal drinking as quickly as possible. Another study that was looking at dairy sheep, it found, this shouldn't be shocking, but it is something that helps to have some quantitative data on, that pain results in reduced feed intake and ruminations of sheep. Can you imagine that? But it's been documented now, so that's science for you. When we're managing that pain, we should not see those significant decreases in feed intake. They might still have a little bit of a decrease, but it's not as severe as if the pain isn't addressed at all. And then improved feed intake, of course, is going to result in higher production during extended lactation. This, again, seems pretty self-explanatory or reasonable, but there was actually a study done that proves it. So when we're dealing with pain early in lactation, right after kidding, then we are seeing improved feed intake, which leads to better production. And when we're dealing with extended lactation, I mean, we really need to be focusing on setting up for success early, because that could be a big chunk of that goat's lifetime and productive life in your herd. So we want to make sure we're getting them to peak production as effectively as possible. So we should care about pain in our animals, and we definitely can impact and improve pain and discomfort by administering NSAIDs in our dairy goats. So what are the options for pain management? There's no pain medication that is labeled for dairy goats or for goats in the United States. So in order to use these drugs extra label, we need to be working with a veterinarian who will help us to develop a veterinarian client-patient relationship. And if you've been on these webinars before, then you're probably sick of hearing VCPR now, but I'm going to say it again. So we need to have a VCPR with your veterinarian, who is then going to prescribe the NSAID, and they can request withdrawal times from FARAD. Even if you go buy Banamine at the feed store, which you totally can do because it's labeled for cattle, you can't follow the withdrawal recommendations for cattle. So you need a separate withdrawal for goats, because those are regulated a little bit differently because it's an extra label use. So we should still be talking to our veterinarian about what pain drugs we have on hand and how to use them safely while making sure that our food supply stays drug-free. There are a couple of different options as far as medication goes for pain control, especially NSAIDs, which are kind of the first line that we talk about. So meloxicam is really handy because it comes in tablets or a liquid. The tablets are super cheap. They're really easy to put in a little capsule, like a gel capsule, and give orally, or you could probably just use, individual pills and give them pretty easily by mouth. I know some of my clients used to give meloxicam in little mini marshmallows, and goats really love to eat mini marshmallows, whether or not they have meloxicam. I'm not advising you to give your goat a handful of marshmallows, but it is an effective way to get medication into a lot of small ruminants. Banamine is the trade name for flunixin meglamine. That's the drug itself. This one is tricky. It's really effective and it's really nice because it kicks in really fast when you give it in the vein. But that is tricky for a lot of producers. And so a lot of times folks will say, oh, it says on the bottle, you can give it in the muscle. And they'll just go ahead and give it in the muscle. But really, that's not recommended. It can cause some pretty significant tissue damage when given in the muscle. And so this can be a really valuable option, especially for really acute pain or right before a surgical procedure or something like that, to be given IV. But if you're not comfortable giving anything in the vein, then we should talk about another option that would be easier for a client to give at home. There is transdermal Banamine. I've read mixed reports. I think the general consensus is that it's not very effective in goats. It is labeled for cattle, but goats and sheep have different skin and hair follicle structures, and that is what impacts the absorption of that medication. So that's one that I don't recommend folks use on sheep and goats because I haven't found it to be very effective. So it is out there, you'll see it, but there are better options for our species. Ketoprofen is a drug that I've worked with quite a bit this summer, and we'll be putting some papers out hopefully early next year, or sending them in for review early next year about ketoprofen specifically in goats. So this is a really nice drug because it can be given subcutaneously or under the skin, and it's approved in cattle for inflammation and fever, I think, due to respiratory disease, but we can also use it as a pain medication. It's easy for clients to use because you can give it under the skin, and then you don't have to worry about those tricky goats spitting out a pill that you've tried to shove down their throat. So if you've got some tricky goats, ketoprofen might be a good option because it's easy to give under the skin. It's not going to cause tissue damage like Banamine might, and you can ensure that the proper dose is given. Carprofen is another NSAID that we use more in small animal medicine, but sometimes folks will use it on sheep and goats as well. Again, it comes in an oral form. They make chewable tablets actually of carprofen, but they're usually meat flavored, liver flavored. And so I'm not sure that goats really appreciate that, but they do have generics that's just unflavored tablets that you can give by mouth as well. So that's another option. A lot of folks that are small animal vets, but will see sheep and goats on the side, might recommend that drug as well. So totally fine. Butorphanol is an opioid that you might hear about your veterinarian using, but I wouldn't recommend this being something that is dispensed for home use. It's one that we'll give as an injectable and can be useful as part of an anesthetic protocol, like if you have a goat getting castrated or a sedation for disbudding or something, butorphanol might be involved, and that's just going to address the pain in a little bit different way from those NSAIDs that we talked about. So we can use multiple types of drugs to address pain in different ways and be more effective in our pain control. Lidocaine, I'm sure a lot of folks have heard of as a local anesthetic that is very helpful for numbing an area for a surgical procedure, or when we're addressing wounds, it can be helpful for numbing the area before we close them up. Some folks will use it for disbudding as well. I found personally that kids tend to scream more when you poke them in the head a couple times to put the lidocaine to do the ring blocks around the horn buds. And Dr. Plummer, formerly from Iowa State, now at University of Tennessee, had published a paper a couple years ago about efficacy of lidocaine with disbudding, and didn't find it to be any more effective to use lidocaine with an NSAID than just an NSAID alone. So if you find that it's helpful and you think your animals are more comfortable using the lidocaine for disbudding, then I would tell you keep on keeping on, but I don't think that it's absolutely essential for pain control in every situation, because some goat kids just do not like it, and it makes them more unhappy. There are two other medications called ketamine and xylazine. These are not medications that clients will probably be using at home. They're sedatives usually, or part of an anesthetic protocol. They're injectables. So we would use them for disbudding. I like to use ketamine as part of my sedation for disbudding protocols. These do also have some pain control properties. They're not appropriate solo pain medications by any means, but they can be another part of that multimodal pain control that I talked about before, where we can use an NSAID with an opioid and then one of these other drugs, probably lidocaine too, and get these animals feeling really comfortable because we've hit the pain pathway in a lot of different ways. And so at least short term, pain control, we can be really effective if we include those things as well. So let's see here. A note about accurate drug dosing. Weight-based dosing is absolutely essential. I know in people, whether you're 100 pounds or 300 pounds, they're probably going to tell you, maybe not 300 pounds, but probably with between 100 and 200-pound humans, we're all taking the same dose, right? Like take 2 Tylenol. And it's not necessarily weight-based dosing, but in veterinary medicine, especially in our realm in dairy production, we do everything based on weight. So we really need to get an accurate weight on the animal before we calculate how much of a drug we need. So there was actually a study done, I think it was out of Texas A&M, that had vet students and animal science students estimate goat weight. So this was specifically looking at weighing goats. And only 37% of the time were these people involved in the study able to estimate a weight, and an accurate estimation was considered within 10% of the animal's true weight. So we're pretty bad at it. And some of these people, animal science students, a lot of them had been around goats their whole lives. Same with the vet students. So they had a range of folks who really didn't have a lot of goat experience and folks who had grown up with goats. And there was no correlation in how good you were estimating weight based on your prior livestock and goat experience. Also, vet students were not better at estimating weights than animal science students, and vice versa. So just generally, we're pretty bad at estimating weights. And I think that probably extends to producers as well. No offense. I'm sure you all know your animals really well, but that really just means we need to invest in a scale. And there's a lot of options. So this one over here on the image on the left here, that's a nice fancy $2,000 scale that you can include in your chute system or your working system if you have that, or you can just throw the goat into it if you're trying to get a weight. That's going to be a little bit on the pricey side. But that's probably the high end of the expense that you would put in for a goat scale. Alternatively, they make these nifty handheld, it's basically a luggage scale with a sling that you can get for $20. And that should give you a pretty accurate weight as well. Now, is that going to be accurate for an animal that you can't pick up because it's 150, 200 pounds? Probably not. But there are other options. I used to have a scale in my truck when I did ambulatory work that I bought on Amazon for like $150. It was a dog scale, but it was large enough to fit pretty much any sheep or goat that I encountered on. And it definitely was more accurate than my estimation of weight. So not to belabor the point, but it is really worth it to invest in a scale to make sure that we have an accurate or close to accurate weight, and that we can be administering an appropriate amount of drug so that we're addressing pain as effectively as possible. Okay, there's my plug for a scale. Let's see here. Okay, so what happens if medication is not enough? Because sometimes there's just no amount of pain medication in the world that can mitigate the discomfort that animals feel in a certain situation. So you can see here, this goat is really emaciated. She had a lot of things going on with her. And she's a pretty miserable looking girl. And so this is a time where we might need to consider, can we fix the problems that she's suffering from? And if not, what should we do about it? So how do you know when it's time to make some pretty hard end of life decisions? And these are some guidelines that are actually available on the Iowa State website, but are very much in line with the AVMA, American Veterinary Medical Association, Humane Euthanasia guidelines, and the American Association of Small Ruminant Practitioners guidelines as well. So if an animal has an injury or disease that results in immobility or severe permanent lameness, we need to be having some serious conversations about that. I've seen plenty of pet goats that, or even, old milkers that just have been around for so long. They've got severe arthritis. Caprine arthritis encephalitis virus, or CAE, can also cause pretty severe arthritis and lameness that can result in a condition like this. So we can't actually fix the lameness. No amount of pain medications are going to make this animal comfortable or return it to normal function. So we probably need to be talking about some end of life stuff here. Emergencies that result in severe or untreatable pain. I've seen a buck with gut strangulation that was absolutely miserable. And surgery just wasn't an option for those clients. And so in order to address the pain, we did end up euthanizing him because it just wasn't fair to let him continue to live like that. Same with motor vehicle accidents. Sometimes the trauma is just so severe that addressing it isn't feasible. And so we need to do the humane thing for the animal. Again, cost prohibitive, painful conditions. Euthanasia is a reasonable option in those cases as well. And I hope that clients don't feel bad about that. I know we all love our goats, but that doesn't mean we can spend $1 million to try and fix them. So euthanasia is very much a reasonable option. And we need to make sure we keep that in the back of our minds. There are sometimes, like I said, CAE, no known treatment or cure, and the long-term prognosis is really poor in those cases. Those animals are going to be pretty severely crippled. And so is that really fair to them? That's a discussion you need to have with your veterinarian. Neurologic conditions, especially things like scrapie and rabies, which we can't know for sure until the animal is deceased. But anything that's showing neurologic signs, I'm definitely having a pretty serious talk about euthanasia with the client, because then it becomes a human health risk potentially, or a risk to the other animals in the herd as well. So these are just a couple of examples of times when we really should be considering euthanasia, but I'm sure there are others as well. So this is the part where we really need to emphasize that this is not a how-to on euthanizing animals. This is just an introduction to the concept to spark a conversation between you and your veterinarian. This is definitely something that needs to be discussed, needs to be trained in person, and we need to keep up on our training and touch base with our vet fairly regularly, just to make sure that everybody's on the same page and that we're doing this properly. So there's also always a degree of risk to humans that are performing this, that are performing euthanasia due to possible for projectiles, especially when we're talking about gunshot wounds, I'm sorry. So gunshot is definitely practical. It's cost efficient. Can be done very humanely and efficiently, and is used on a lot of large commercial farms every day. Totally a viable option. It's really important that we're selecting the proper caliber and the proper bullet type. So hollow points, probably not really the best choice for large mature animals with horns. This is also nice because you don't have to be in direct contact with an animal. So especially on like cattle ranches or bovine dairies, sometimes we just really don't want to be right next to an animal that needs to be euthanized, especially if it's in a lot of pain and we can't restrain it very well. In small ruminants, especially in dairy goats, these are animals that are used to being handled and are pretty easy to restrain, even if we can't get them to a chute or something like that. So, but you can perform this from close range, but not direct contact. And gunshot is considered a single step euthanasia method. So we're going to talk about 2-step methods in a minute. But for this, it's just the one shot. And as long as we've confirmed that the animal is deceased, we don't need to do anything else. Penetrating captive bolt, there is an initial investment because we need to purchase a specific piece of equipment. And I have an example of one of those here on the right of your screen. So we do recommend a secondary form of euthanasia with penetrating captive bolt, although penetrating bolt gun can produce death. On its own, it's best just to triple check and be sure. So we can do things like pithing or exsanguination. Injection of potassium chloride is also acceptable, but it's not probably something that producers are going to do. But I just wanted to put it on there in case people go and do their own reading as well. So pithing is when you would take a long, skinny object, like some folks will use like a thin screwdriver or something like that, and actually put it into the wound that the captive bolt gun creates, and cause further trauma to the brain matter, so that we're being sure that we've really completely turned off the brainstem and the animal's no longer alive. Exsanguination is also totally reasonable, although messier than pithing, I will say. Um, so this is used a lot of times in abattoirs or slaughterhouses, where the animals need to be bled anyway. The animal needs to be unconscious first, which is where the captive bolt comes in. Um, exsanguination is not an acceptable method of primary euthanasia, according to AVMA. So if the animal's awake, not recommended. Injection of potassium chloride is something you may see a veterinarian do, where it's a hypersaturated solution, and basically it just stops the animal's heart after the captive bolt has turned off the brain, essentially. This is really painful in animals that are conscious and awake. So these animals need to either be under full general anesthesia, which means controlled substances that only a veterinarian will have, or penetrating captive bolt used effectively first. Or non-penetrating captive bolt with a secondary injection of potassium chloride is also acceptable, but the animal needs to be rendered unconscious and senseless before this is used. Just to note, any firearm or captive bolt equipment needs to be cleaned after each use. In a situation like a mass casualty incident, we've seen truck rollovers before in Iowa State, or at like an abattoir type setting where these are being used over and over again in the same setting. They may even need to be cleaned during that session if multiple animals are requiring euthanasia at that time. So maintenance is really important, and firearm safety just cannot be overemphasized here. Okay, again, this is not meant to make folks feel confident in just going out and performing euthanasia, but I do think it's important to talk about landmarks so that we need to hear these things multiple times before you're ready to go perform euthanasia on an animal. So there's two different options in horned animals, like the goat that you see on the left. You may do a line from the pole to the back of the throat, so right behind where the horns connect, basically in the center of the back of the head. Or you can go from the front of the skull and aim towards the spinal cord, which is that second arrow with the thicker dots. I should have made it a color or something. That would have been really helpful. But the longer dashes would be option 2, where we're going from the front of the head. In hornless animals, the top of the head or directly behind the pole is a really easy landmark to find. And then just aiming straight down towards like the throat latch area is usually very effective. And again, this works for either gunshot or a penetrating captive bolt. Iowa State has a really helpful resource on performing humane euthanasia with a gunshot or a captive bolt. So the link here at the bottom of the screen will take you to that. That's a good place to do some reading, again, before or after you talk to your veterinarian and get some in-person training. So once we have performed the euthanasia using gunshot or captive bolt, it's really important to make sure that we accomplish our goal and that the brain function is completely stopped. So some signs that you will see that can give you an indication that that is correct, and that's what you've accomplished, is the animal will collapse immediately. They're not attempting to rise or sit up or right themselves. Also, instant muscle rigidity. Their legs will go stiff right away. And you may see some involuntary movement, especially like a couple of kicks from the hind legs. Pigs are really dramatic after they're captive bolted, and they'll thrash and throw themselves around. Not really what we see in small ruminants. It's usually the worst that I've seen is that the back leg will kick a few times. normal breathing will cease. You may still see them take a few breaths where that's just an agonal breath. That's kind of just the brain's way of shutting down and just randomly firing and triggering that breathing mechanism. But normal, steady breathing will stop if you have performed this correctly. And then what you see in the picture here is checking the corneal reflex, which is one of the easiest things and things that I always do and makes me feel confident that I have accomplished this appropriately. So you're just going to take your finger and touch the animal's cornea, touch their eye. And if they don't blink, then you've done your job properly. So that's really the test. The heart may still beat for a few minutes after brain function has stopped. And again, that's just kind of the body's way of shutting down, and it takes a little bit of time. So checking heartbeat is a good idea after you've performed euthanasia, but it's not the first thing that I do. I check the corneal response first, because that is my way of knowing what's happening with brain function. If an animal vocalizes, that can indicate that it's regaining consciousness, and we need to address that immediately. So usually that means firing another shot. I would not go to my secondary form of euthanasia, so the pithing or exsanguination or potassium chloride, if that's what your vet sets you up with, without addressing this with a primary method. So it's probably going to require another gunshot or another captive bolt before you can move into the second phase, if that's what you're choosing to do. Some folks, especially folks that are very emotionally attached to their goats and sheep, especially dairy goats that have had, long show careers or really long productive lives, gunshot or captive bolt can be a little bit traumatic for the owner to watch. Although I think a lot of times it's really smooth and painless process. It still is a little bit unpleasant for clients to watch. And so sometimes folks will ask for injectable euthanasia, and this is something a veterinarian needs to perform. But when you're planning this, if that's the way that you choose to go with your end of life, with the end of life process for your animals, it's really important to think about what you're going to do with the animal afterwards. A lot of times we'll use rendering or composting to dispose of carcasses after the animal is deceased. We cannot put these animals into the rendering chain if they have been euthanized with a barbiturate. That's how you get tainted pet food. So we cannot render the animal. We really shouldn't be burying the animal because these medications will live in the groundwater for a long time. So we can contaminate our groundwater. There's also a risk of, if animals scavenge and dig up the deceased goat and then consume that, they could very well become deceased themselves. So the only real option is cremation. And if this is a pet and you want to keep them with you, then cremation might be a reasonable option. Otherwise, we probably need to talk about a different method of euthanasia with your veterinarian. So just a little note, I want to make sure that folks are thinking about that before they have to make a decision. And there are plenty of other options, but it's also something to bring up with your veterinarian if they don't commonly see livestock species. More and more small animal vets are being willing to see sheep and goats. And so I think it's important to make sure that we're aware of this issue as well, so that we can say, okay, now this is going to be safe for me to send to rendering or bury, or what drug are you using? Are you using euthanasia solution? If so, then we need to be planning on cremation or find another way to end the animal suffering. If you're curious about barbiturate overdosing or the rendering process and aftercare for livestock species, we actually did an episode of Boz and Bleats on this exact issue in season 3 and episode 14. So feel free to check that out. I thought it was one of our more interesting episodes as well. So always love to plug the AASRP podcast. But again, can't be rendering animals that have been euthanized with lethal injection. So, just a couple of take home points to wrap things up here. Pain certainly negatively impacts dairy goat production, animal welfare, growth of young stock. There are a whole bunch of different ways that animals in pain can negatively impact the bottom line, and of course, our animals' health and welfare. So, identifying and treating pain effectively can certainly be done by clients. You don't have to have a veterinarian on farm every single time you think an animal is suffering, but it requires appropriate training and collaboration between the animal care staff and the vet team. Humane euthanasia is a viable treatment option if pain and suffering can't be managed medically. Whether it's physically we just can't accomplish that, or financially, either way, euthanasia is a reasonable option. So we need to make sure that we are able to deliver that treatment in a timely and effective manner, and that it, of course, is always done humanely. Producers can be trained in end of life decisions and on farm euthanasia so that the animals, if they're suffering and it's an acute problem, then the animals don't have to wait. But this really needs to be an active dialogue and training from the veterinarian of record for that farm, and follow-up trainings may be necessary as well. If you need to find a veterinarian that works on small ruminants, you can go to the American Association of Small Ruminant Practitioners, AASRP website, aasrp.org. Go to the About tab and then scroll down. I think it's the second option under there that says Find a Small Ruminant Veterinarian, and then type in your zip code or your town. And they should be able to help you find someone. But safety first, safety last, safety always. We need to make sure that we're being safe and that our animals are safe as well. So with that, I'm happy to take questions. Feel free to send me an email. And my new email address is up and running for Cornell. So happy to field questions about this. And then if you have questions about any of the research that I talked about today, these are the sources I used. So, Jen, how are we doing? Did we have any questions in the chat?
I haven't seen any questions yet, but I want to thank you for the information that you provided here today. Something that's, sometimes we don't always want to talk about, but I think it's good to have those conversations ahead of the situations and have a plan in place with your veterinarian on these topics. So again, just appreciate the awareness of what we should have in place here. I did put in the chat the link to the webinar evaluation. So as people are logging off, if they could just click on that link and take a few minutes to fill out our evaluation, that helps us with our continued programming here at Iowa State. And then also I put in here two web links. Michelle, one is from the Vet Med, Iowa State University Vet Med on animal welfare. So it has a bunch of different resources and tools on humane euthanasia. So I thought I'd link that, as well as our former ag engineer, Brian Doherty, did some previous webinars and some resources on composting. So if people are interested in taking a look at that, it is relative to dairy cattle, but I think the concepts of the composting process would apply to our dairy goat and sheep people as well. So just thought I'd put those in there as well. Larry, I know my colleague Larry Tranel is on the call. Have you seen any questions come in?
Yeah, I haven't seen any, and I appreciate you covered the topic pretty thoroughly. So I was figure I have a few questions at the end, but I don't have any. But does anybody else have a question?
Okay. Well, you know how to find me if you do, if you
Yeah.
think of something later. But Jen and Larry, thank you so much for inviting me to be here today. And yeah, have a great day, everybody.
All right, thanks. And I do want to remind people that our next webinar will be coming up on November 18th. We're talking about managing reproduction to maximize production. Dr. Rosie Bush with UC Davis is going to be on talking about reproduction strategies. So hope you can join us then. And thanks again. Have a good day.